Hi, I'm Steve Kep, co-founder of From Day One, our forum on corporate values, and we're looking forward to hosting today's webinar. Today, we'll be exploring a topic that focuses on health equity, employee benefits, and what employers can do to acknowledge social determinants of health and support the needs of their diverse workforce. Our title for today's session is Embedding Diversity and Equity into Your Benefits for All Families. Given that one-size-fits-all health benefits tend to be exclusionary by nature, what steps we'll be asking can employers take to ensure their workers are treated as individuals? How can companies root out implicit bias in their healthcare policies? Why is it so important to take into account the social determinants of health, ranging from environmental factors to mental health issues like stress and anxiety? What are the most successful and needed point solutions to fill the gaps? Our sponsor today is Ovia Health. I'll tell you a bit about them. Ovia Health is the leading women's and family health technology company with over 15 million members. In this webinar, we'll explore how employers can leverage once in 100 years type of public health crisis to drive positive change and health outcomes for working parents. Now, a few quick logistical items. This webinar is being recorded and will be available on demand soon after the event, so look out for an email in about 24 hours with the link. That email will also have info on how you can get professional development credits for this session from the Society of Human Resource Management. And look out for a written account of our conversation soon on our website at fromday1.co. At the top of the hour, in 1 hour, we'll have a Q&A session. You can submit your questions anytime using the Q&A button at the bottom of your screen. Now I'd like to introduce our moderator, Caroline Hrancic, the careers editor at Insider, and former senior editor of Employee Benefits News, a workplace benefits trade publication. Okay, Caroline, over to you.
Thanks, Steve. Like Steve said, my name is Caroline Hrancic. I'm the careers editor over at Insider. And I'm really excited to be moderating this panel today. We have a lot of great speakers, and I think it's going to be a really interesting discussion. Before we get started, I'd like to have each of our panelists just go around and briefly introduce themselves and talk a little bit about what they do. Bethany, do you want to start us off?
Sure. Hello, everyone. I'm Bethany Saint Clair. I am the Director of Equity, Diversity, and Inclusion for OpenText. I'm thrilled to be here. I've been a remote worker for 20 years, and I have run my own shop, so I've had to pick benefits before in the past. And so I'm happy to share some of the things I've learned.
Great, thanks, Bethany. Gina, how about you jump in?
Hi, everyone. I'm Gina Nebasar, Chief of Product Development at Ovia Health, which is a digital health platform for families, spanning the full spectrum of family health, from family building through parental health and well-being. In addition to being a covered benefit at thousands of employers across the US, we also have a very deep commitment to research, national research, to inform not only the efficacy of our solutions, but also health policy decisions for families. We take on some of the world's most complex challenges, from the national cesarean epidemic to social determinants of family care, and have published over 35 peer-reviewed studies in that area. And in addition to leading product at Ovia, I'm also an Ovia mom of 2 and 9 months pregnant with my 3rd. So thank you all for forgiving me if I run out of breath or if my little ones come running through. But I'm also, navigating the great journey of pandemic parenthood along with our audience. I'm so excited to be here.
Great, thanks so much, Gina. Sabina, you want to introduce yourself?
Hi, everybody. My name is Sabina Gebczyk. My pronouns are she, her. I lead global diversity, equity, and inclusion at Ingredion. We are an ingredient solution company, so we make starches, sweeteners, biomaterials that are used by our customers in food and makeup, pharmaceutical products. For me, I don't have a typical HR background, so my background is in social justice and social work. So I kind of, how I approach my work is from that perspective. I kind of go beyond the typical business case for diversity, equity, and inclusion, and really look at it from a social justice perspective. So I'm super excited to be here today and participate in this discussion about health and equity.
Thanks so much. Louis, do you want to introduce yourself as well?
Yeah, sure. Hi, everyone. Louis Amos. I'm the Director of Employee Benefits for the City of Atlanta. My responsibility lies with both insurance benefits and pension. The City of Atlanta is the largest municipality in the Southeast United States, probably one of the 7 largest in the country. So I'm happy to be here and happy to share about the public sector aspect of benefits and the things that go on in our world.
Great, thanks so much. Guillaume, would you like to introduce yourself?
You're on mute.
I think you might be muted. I'm not sure if your sound is working. Jorgen, why don't you introduce yourself briefly while we figure out the technical difficulties here?
Absolutely, yeah, we'll do that. Yeah, hi, my name is Jorgen Peterson, and where Louis was saying he was from the public, I'm from the international side. I've for the last 5 years been the Vice President of Compensation and Benefit for the French group Saint-Gobain. We basically produce building materials, and to think about it in the ways that we help make your home more beautiful, more sustainable, and hopefully more comfortable at the same time. Created back in 1665 by nobody else than Louis XIV, the Sun King, when he wanted to create the big hall of mirrors in Versailles. So in addition to that, I'm on with a startup called the Birch Tree, where we work on developing customer-focused employee benefit solution and how we can support companies basically improve performance through customer employee engagement, through cost optimization, through the optimizing on the social aspect of ESG. And so my 2 key points will be customer focused, which is kind of my background.
Thanks so much. Guillaume, do you want to try one more time, see if it's working now?
All right, can you hear me now?
Yes, now we can.
Oh, perfect. Success. Hi, my name is Guillaume Bagal. Pronounced he, him, his. I am Vice President of Diversity and Inclusion at UNFI, United Natural Goods Food. We're the largest distributor of natural goods in North America. My background is actually in healthcare. I was Director of Policy at the Center for Global Health and Diplomacy, and for about 7 years, I did policy work in DC, working with maternal, newborn, and child health, LGBTQ people. As a gay man myself, that's something that was incredibly important for me. And it's been a joy to take that policy healthcare background and really use it in my role as a head of diversity and inclusion at United Natural Foods. So happy to be here. Thank you.
Great, thank you all so much for being here. As a reminder to the audience, as we chat, we're gonna have a Q&A at the end, so feel free to drop your questions in at any time, and we'll get to them at the top of the hour. So the first question I have is, where are some of the gaps that we're seeing in benefits programs when it comes to supporting underrepresented employees? I'll throw that question actually to Gina just to start us off.
One of the biggest gaps in employee benefits programs surround supporting caregivers and working families with even larger values in those in underserved and underrepresented groups like BIPOC mothers, single parents, women, vulnerable populations, the LGBTQ community, and then caregivers, those supporting both young children, but also their elderly parents. There has been a long-term gap in terms of supporting these communities as they grow their families, return to work after having a child, as they navigate the challenges of pandemic parenthood. And many programs and employers are missing programs to improve maternal health outcomes, mental health, work-life balance. The data is showing that this lack of support is having a big impact on our workforce. There's been over 2 million women, for example, that have left the workforce since the pandemic started. And taking a look at Ovia's data, we mentioned, we've served over 15 million people, and we're starting to notice some alarming trends in the data with respect to care delivery for maternal health and mental health as well. So, for example, as part of our behavioral health program for new and expecting parents, we'll deliver them the Edinburgh Perinatal Depression Scale, just one of the most common risk tools or instruments to identify depression in perinatal or postpartum women. We're noticing some pretty alarming trends in terms of mental health. So increased risks for moderate or severe depression, and the greatest fluctuations for women ages 35 to 39. The most alarming trend is amongst BIPOC mothers, specifically Black mothers. We're noticing a significant increase in suicidal ideation amongst Black postpartum mothers compared to their white peers, which is really alarming. That being said, I am starting to be hopeful that the pandemic is exposing a lot of these inequities amongst these programs, and will really open the nation's eyes to what parents and vulnerable populations are experiencing. Our workforce just simply cannot afford to lose an entire generation of working women and mothers that are at this point making pretty impossible choices between their careers and their family and their personal well-being.
Louis, what are some of the gaps that you're noticing?
Well, in my particular area, as you know, we cover both active and retired employees. So the population, and as you know, for public service employee, a lot of times they would forego, from a financial standpoint, in order to have benefits. We have a unique perspective in that we're one of few employees who have an on-site wellness center along with fitness centers. But the biggest gap, and one of the things that we have, is that we have an internal EAP, and we work with them in terms of products and services, and demographics, area. We're in the South, we're in the stroke belt. There's a high propensity in terms of for chronic diseases, diabetes, hypertension, obesity. So you add all these factors, and you add the factor of the mental health piece. It is a challenge. We found, and especially in this global pandemic, how much it is a challenge that we faced. Case in point, we've had frontline employees, meaning police and fire and water and sewer and sanitation. And these folks have had to, even during this pandemic, these folks have had to work. So how do you prepare? How do you, one, keep them safe and then keep their family safe? So there's a lot of gaps. I mean, we've been able to maintain, as I say, keep the train on the track. So we've done well with that. But it's been a challenge. I mean, because one of the things we found out is that this pandemic has impacted folks in ways we never thought before. And running a city, when you come in a city, you want police protection, you want fire, you want the water, you want the trash picked up, and being able to maintain that is a very difficult task. I mean, given just day to day, not adding the pandemic. So, I mean, there are a lot of gaps, but unfortunately for us, we've been able to maintain. But it has been a difficult process.
I would like to speak to that a little bit. That at OpenText, we're discovering that moving to the remote work model is a way to help close some of the gaps, and acknowledging what people are dealing with. So Gina was so brilliant to be like, yeah, I'm a mom, I've got some kids, they might burst in here, and you see everyone is super understanding. Like before the pandemic, that people were not understanding of that kind of thing, right, at all, for a remote worker. They're like, be professional, and now they just get it. That's what it means to be at home. So we're at OpenText taking our learnings from remote work, where before the pandemic, it was about 20% folks were remote workers by way of acquisition. Simply, they weren't close enough to an office. And then everybody was remote because we don't have the challenge that Louis has, that folks, like, we had very few people that actually needed to show up to an office. Like, we've got some data centers, right? And so then we could see and explore what could remote work do for us in helping close some of these gaps, right? And in addressing the mental health, that's been a big deal. Like, we're noticing it too. And we've tried to start a discussion, like conversations around it, so that people can feel more free to talk about what they're dealing with, and to understand that it's not going to be held against them, that we're just here to support them. So I think that's really important. So I wanted to contribute that.
And I'm just going to quickly add that I'm so happy to already hear people talking about mental health, which, as you all know, basically everyone has been impacted by this pandemic. So at UNFI, we've definitely pushed the services that we already have available to associates on EAP. Not unlike many organizations, UNFI saw a lot of savings in healthcare this past year, which you can celebrate, but you can also wonder, what does that mean? Many communities already defer needed medical care, like LGBTQ people, people of color, even when they're hurting, which is why in the Black community, for instance, the diagnosis for cancer are more likely to be at stage 3 or 4 versus earlier diagnosis. So when we're looking at these healthcare savings, we also had to go and look at EAP. We know that many people experiencing anxiety and depression are people actually taking advantage of these services that we have offered there. Looking at the data, who's taking advantage of it? And one thing that I did want to touch on is how we talk about these issues. Communication is incredibly important. Many of us are working from home, but a friend of mine recently joked, am I working from home or living at work? Everyone is, I've seen where everyone lives, and by now, many of us are used to it. So really be thoughtful about how we talk about these things. When we talk about returning to work, remembering that at UNFI, for instance, approximately 10% of our workforce never went and started working from home. So it's like, whoa, we have been out there in the field, frontline workers. So when you are sending these messages, remember us. And finally, going back to normal I'm hoping that many people are being sensitive about that, because as Gina mentioned earlier, things were not so great before. We're now looking at inequities that were already existing. So do we want to go back to normal or find a new, better normal? Thank you.
Yeah, I just want to ask from our perspective, and I want to go back to something that Gina said about women. So for us, we are a manufacturing company. We are a man-dominated company, but we have women in our plants and manufacturing plants. And what happened through the pandemic was really more focus on our women and focus on equity versus equality, right? We were always under impression that, it's fair to provide everybody the same opportunities, the same benefits, but here we are, pandemic hits, and we have mothers at the manufacturing plants who are caregivers. And they have to take care of their families, little children. So it's different now. We really have to focus on equity and really focus on providing our employees what they need to be healthy, safe, and successful. And I was just thinking of what Gina was talking about, women leaving the workplace, which is kind of every year, McKinsey comes out with the report, right? Women in a workplace. And when they published the report this year in September, they stated that they think that 1 in 4 women is going to leave the workplace. And that's a huge part of our workforce. So it's really, it's throughout the pandemic and everything gave us just a even more focus on our women and what they're going through, and especially our women of color, because the amount of trauma our women of color are going through every day is even, bigger.
Yeah, let's talk about that a little bit more. Sabina, how do employers create benefits policies that support employees from underrepresented groups, particularly people of color, LGBTQ plus employees, as they process trauma and think about the emotional labor and stress that they face at work every day?
Yeah, so every time I think about it, I work very, closely with our benefits team, and how I want to take a couple steps back. So there's one thing about creating policies and programs that are standalone. And there's another thing about really embedding the mental health and well-being into work. And I think throughout the pandemic and throughout last year, this is what we've seen really happening. There were talk about it already in 2019. Deloitte publishes the global human capital trends every year. They mentioned it, but they really did dedicated the entire section to embedding well-being into how you design work this year. And I think for us, it was interesting, for example, when George Floyd's horrific murder happened in the summer, we actually really looked at amount of trauma that our Black employees were going through, and amount of emotional labor that was put onto them right after that Memorial Day weekend, right? And how other employees were just like seeking education from our Black employees, and it was just too much. It was really too much. So for us, it was making sure that it's normal for us, and it was really quick to provide all the managers with the resources that they needed to create safety for their Black employees, providing space to talk about it, to normalize that we do talk about this at work. And then looking at our employee assistant program, one of the things we realized really quickly is that when you call our assistant programs, there's not many Black counselors that I can actually, or a therapist that can help. And our employees were seeing that gap. So we as a company jumped really quickly and found a therapist that was providing services to our employees who needed it. So really, when we talk about gaps, identifying them really quickly and just like kind of closing the gaps however you can. But it's also about normalizing the amount of difficult topics that are happening in the society and talking about this at work. Like mental health is right now big, and it's not becoming, there's so much kind of taboo around mental health, but throughout the pandemic and what happened last year and this year with all the violence that different communities are going through, like really creating a space at work and safety space, because, there has to be this well-being in work space.
Also, to those points too, that maternal health, if you look at maternal health outcomes, data like maternal mortality, those reveal a racial divide that's absolutely devastating. I mean, Black women are 3 times as likely to die from childbirth than their white peers. And with COVID-19, that's disproportionately impacting maternal care for women of color. For example, we've done some research with the March of Dimes, the nonprofit organization that's really leading the fight to improve health outcomes for all moms and babies. And we identified that Black women, like 61% of Black women were reporting less frequent, lower quality maternal care throughout the pandemic, which is just threatening to further deepen these inequities if the organizations don't take action. Without routine care, these mothers and these babies have increased risk for serious health conditions, including infant and maternal mortality, as well as low birth weight or preterm delivery. Some things that organizations could really do, or to Sabina's point, some tangible things that they could do is normalize it and provide one-on-one support that is really representative of their community. So, for example, in Ovia, we have digital health solutions where people are coming back multiple times a day. You can talk to a health coach that truly you can have preferences in terms of race or your community. And so if you think about even maternal mortality, where 4/5 occur before or after birth during that postpartum period, something like a digital health solution could make a huge difference. That's why I think we're going to is like, what does the future look like? What's the new normal? How do we introduce these sort of digital solutions that could sort of cross that divide and address some of these inequities? And then more is just around increasing access to doula care, birth centers, mental health care, remote monitoring services, bringing critical care delivery into a person's community as opposed to, asking them to step out. And then to Sabina's point, the unbiased and trusting environment. One thing we did, we've invited the National Birth Equity Collaborative to speak to health plans and employers, the companies we work with, on how to address some of these racial inequities. We've also invited them in to train our organization on how to address them and normalize a lot of these areas, so that we're not addressing these racial inequities in a vacuum. That we're taking time from the thought leaders and the people that are leading the charge to really learn from them before we take action.
Yeah, and one more thing I want to just add to what I was saying too is normalization is so important. Like that your CEO acknowledges what's going on. So, whatever happened last year, the violence against Asian community that is happening against immigrants, indigenous, LGBT, unfortunately, it's a very violent world. But our CEO acknowledges it with the email and sends a message to the organization that, if you are our Black employee and you're coming to work after something very traumatic that has happened, it's okay not to be okay. We're not expecting you to be okay. Use your flexible time, use whatever time you need to grieve. We encourage our entire workforce to reach out to each other, to support each other, and really creating that understanding that we're not okay right now. Nobody is operating as okay, because we're in the midst of pandemic, and we just, as a society, we keep going, but we have to acknowledge that it's okay not to be okay.
I couldn't agree more, Sabina. And at UNFI, it's been a priority to make sure that those messages happen in a timely fashion, and that we don't spend so much time concerning ourselves with the comfort of white people versus speaking on issues that are impacting those populations. I mean, it's kind of like, well, 20% of our associates probably feel this a certain way based on where they are geographically. These are so political, or the whole idea of people, not politics, when you really, anything can be politicized. The masks were politicized, global warming is politicized. As a gay man, as a Black man, as an immigrant, my identities are politicized. So at what point does the organization choose to say something about something, And to Gina's point, the inequities in mortality is something that I'm incredibly passionate about, because it's actually been getting worse over the years. Like, the gap in inequities is widening. And when you actually look at that data, a Black woman with a PhD is still more likely to have issues during her pregnancy than a white woman without a high school degree. And also, another really interesting study showed that Black women who immigrated from Africa did not have the same issues as Black women who were born and raised in the US. So when you really talk about like the stress and all of that, and the last thing I'm going to mention for this part is Doula Services, as Gina mentioned, is like something that many organizations should really consider covering. And that's a policy that I changed when I was head of diversity and inclusion at Blue Cross and Blue Shield of Rhode Island, making sure that, I spoke with our lawyers. It's, of course, there's a lot of fear. What's next? Are we going to have to also cover massage therapy or all of these other things? But when you're actually trying to move the needles on these issues, these are the hard decisions you have to make.
I would like to chime in as a woman of color, Black woman here. I've personally experienced these health disparities when I have 3 children, and I made my 3rd baby safe by having my baby in another country. That's how it went on the first 2 babies. And my mother's a doctor. On the very first baby, she had to argue with the medical providers when I said I didn't feel well enough to go home. I needed another day. These are profound differences in how people are given healthcare. When I speak with my friends, I'm very blessed to have friends from all over the world and from all different demographics in the United States. And these differences and experiences are very stark on how people experience these things. So to speak to that is something that has to be addressed. And that as companies, we are big customers to these insurance companies. We pay, okay, we pay. And that is an opportunity, like Gina spoke to have a discussion with them about these things and how they're addressing this in their networks. How are they making more doctors of color available? How are they working with the various organizations, the various hospitals to make sure that their doctors are trained? There was a survey done within the last couple of years of 150 medical students, and half of them thought that Black people don't experience as much pain, which I can personally attest to experiencing that and not getting pain management that I needed. And so these things, it's hard when it's systemic, right? Because it's not just at the company level or the hospital level, or it's everywhere. It has saturated us. And we have to acknowledge that, because we have to address it in a lot of different places to be able to begin to make it right. So that's an important point I wanted to make, was that, yeah, these disparities are universal. And for the various marginalized minority groups, it's not, oh, this person's a minority in this, pretend this is in different countries. You pick the marginalized minority in that country and ask them about their experience, and it's not great, right? It's universal. It's not they might have experienced it. No, it's how did it go when you experienced it? How did you survive it? Those are the questions to ask. And I mean, I'm thrilled to see people talking about it. And to speak to mental health, OpenText, we've said very clearly that mental health is a part of health. We don't have a limit on sick days that people can take. And it is okay to take a day for your mental health. That is legitimate. Mm-hmm. And we try to make that very clear to people, that you nurture that so that you don't fall down, that you acknowledge that you need to take care of your family. And so I wanted to contribute that perspective for folks.
Thank you. Jorgen, I wanted to give you an opportunity to talk.
Yeah, I maybe want to grab onto part of what Bethany was just talking about, the international part, because we're really seeing, I mean, there's always been huge differences between the countries, but we're really seeing that during the pandemic, that because the health systems are so different, and because the pandemic it's just had different curves, depending on where you were in the world, it has given some huge challenges for us as companies to really make sure that our people are safe, to really make sure that our people are covered, that if something happens to them, if they get it, that they're covered, and afterwards, how are they paid in the system, which again is different from country to country. So it has given some additional, I say, complexities, because all the differences which were there before have really just been magnified in this spectrum. And of course, as a big international organization, we have felt responsible for our people and to make sure that, yeah, if something happens to them in this situation, we help them.
Great, thank you. I'm going to throw it really quickly back to Steve, who's going to jump in with some announcements.
Hi, everyone. I'd like to remind anyone joining our webinar in midstream that we're from day one. We're exploring how to embed diversity and equity into your benefits for all families. Our sponsor is Ovia Health. As a reminder, you can submit your questions at any time, and we'll answer as many as we can during the Q&A session. Now back to you, Caroline.
Thanks so much, Steve. So Jorgen, I'm actually going to throw it back to you with another question. So, we've been talking about all of these benefits, and I know that one of the challenges with benefits programs, like even if you offer a lot of benefits that could help diverse populations, communicating them is incredibly important. So, how do you make sure that employees know about these offerings and the things that you're offering to support them, especially if you have a diverse workforce across multiple countries that have very different needs?
Mm. And I think before you even start communicating, I think you need to go back and really try to figure out who are your customers, or what do your customers want, and frankly, dare to ask them, dare to try to find out what is it that they would like, and how there are plenty of ways to do this, and afterwards take that. And I mean, I spoke about before how there are differences as in some in the health system, but if you understand what your employee, your customer wants, if you understand the health system in the individual country, now you can really start to build up, I say, individual solutions where you give choice to employees. Because if it's one of those where there's so much demand and we can't give everything to everybody. And if instead you give people something which they want, then $1,000 is a whole lot more worth for somebody if he or she gets exactly the type of health system or support that they need, rather than everybody gets the same, so to say. Then when it comes to communication, well, again, here the pandemic has been interesting, because we used to be very much kind of multi-channel. It could be fully digital, and it could be the poster on the wall. Of course, today, as many of the colleagues spoke about before, most of our employees, the same for us, are in remote office, not always home office, it can be remote wherever, but So right now, the whole communication using the digital and really making sure that we get to our people, even if they are at home, and try not to, let's say, overcloud them with information, because then we probably all get so many emails and so much information that we frankly scrap a lot of it because we don't have time for it. So if we want to make sure that we reach the person who should receive this message, then we need to be tailor-made. We need to make sure that we think about how we get to these customers. So thereby also using the new way of working to frankly be better at this. I mean, there's unfortunately no magic recipe and all this. It's just continue and improve and listen to your customers, figure out what they know and so say sometimes what they don't.
Louis, how are you thinking about this, like benefits communication for your workforce specifically?
Well, in my particular workforce, I mean, we're covering anywhere from the newborn to the 100-year-old person from a retiree standpoint. And on top of that, you have to have the ability to communicate at various different levels. You have engineers, you have folks who, from a literacy standpoint, are challenged. You have to learn how to meet your audience where they are and focus. I know there's a big push right now. One of the challenges we face is because of an aging population. I mean, you do a lot of things with apps and online and things of that nature, but there is a segment of the population that you got to have a way to communicate with them totally different. And this one size fit all approach doesn't necessarily work, especially with an 80-year-old person. There's this whole fear of technology. I mean, you got to get around that aspect. I mean, even if it's for an example, we did an open enrollment for the first time last year, where typically we would have meetings where they can come in and it's kind of a festive affair to get a chance to see their friends. But, because of the pandemic, we couldn't do that. So what we had to do was develop a process. Obviously, we're using apps and you're using other sources of communication, but we pretty much had to develop a kind of a telephonic process. So those folks at least had someone to touch base with it. I mean, and dealing with a retiree population, an aging population, they want to talk to somebody. I mean, if they got nothing else to do today, and one of the things we clearly learned, one of the things I know being over both insurance and pension, there are two things that's important to especially our older population. One is a pension in terms of supporting yourself financially, and then secondly, it's the medical aspect. So when you're communicating those two things, you have to have flexibility. You have to understand your audience, and you just have to, like I say, one size doesn't fit all. So it means that you got to try creative things. You got to always have the flexibility to adapt. And obviously, as we all know, in this current environment, we've had to have the flexibility to adapt. In a public sector environment, people are used to coming down to City Hall or going to the regional office or something of that nature. When you stop that, but still things have to continue to go forth. And, it's called flexibility and being able to adapt.
Definitely. So Gina, how can the industry help address social determinants of health for employees, especially for new mothers and for BIPOC communities?
Some of the areas we were discussing earlier in terms of some tangible things organizations can do to address these inequities is, I think, first listening and trusting and before responding to Black mothers, increasing access to virtual solutions, access to care like doulas, birth centers. I think the third thing is really around creating those unbiased and trusting environments, and how do you normalize those discussions, whether it's through training of managers or bringing in external parties. We could also, increase access to the data and look at these disparities from an analytical perspective. And this applies to across the industry, not just employers, but health plans, policymakers, technologies like Ovia. And then I think also on the note of the personalized support as well, and that one-on-one. So Ovia is very much a digital health platform. It's a digital health approach to condition management and prevention, but we have that strong human component. So each and every person on Ovia has access to a dedicated team of certified nurse midwives, lactation counselors, pediatric nurses, and they're providing that really personalized support as well to understand, what is a person's unique barrier to care, which can be very different. We talk about all these different areas, whether it's access or education, but one example is just a couple of weeks ago, one of our nurses was reaching out to a member on Ovia, asking her about her postpartum birth control plan. And the member said something like, I can't get the depot shot because my boyfriend said it will make me fat. And if you talk about a barrier to care, that is somebody's very specific, unique barrier to care. And I wonder, if not for a digital solution, would that conversation have ever happened, when most times postpartum birth control isn't brought up till the postpartum checkup visit? As many as 40% of those visits aren't adhered to. So if it weren't for that approach of that one-on-one support of someone with a clinician, but also I'm just open-ending question, what are you thinking about postpartum birth control, to really understand that person, where they're coming from, validate their concerns. I wonder if that conversation would have even happened if not for that approach.
I think Gina has a great point, and so does Lewis, that when it comes to healthcare, you cannot get out of two concepts: some level of high touch and some level of one size does not fit all. Both of those things are always going to be true. Like taking care of each other's health is just like a human interaction. I worked for 8 years as the lead engineer for Morehouse School of Medicine. We created and patented this app. It was one side of it that brought together health coaches, doctors, and patients, pulled in their data from a bunch of systems, the EMRs, the tests, their own devices on how they're doing, and then spent 8 years studying how that human touch in combination with technology makes the difference on people's health. People's health really will get better if you use these things together, but you don't ever get out of human interaction. Like, that's not an end result of technology, and that is not going to give us outcomes that we like. Technology works best when it helps bring humans together, right, to solve problems. And we saw that. We saw statistically proven increases in outcomes for people in underrepresented groups. And we did a lot of work in Atlanta, and a lot of elderly, and it was that combo.
Yeah, I totally agree with everything that was said, and it made me think really about also for like the corporation and businesses and even hospitals too, really educating the managers about lived experience, because so many times we have seen people argue somebody's lived experience, right? So we hear from Black women how they're treated, and we hear from employees how are they, for example, for us, for our women, how they're treated on the manufacturing plants. And sometimes what I see in managers is like arguing the lived experience of a person, and not being, well, if you try this or if you try that, just really, really educating our managers about, like, you can't argue the lived experience, and it's really about empathy and humility, right? And just putting yourself in the person's shoes. And I think that's a biggest struggle.
I really, that really resonates with me. As I'm training our HR on how to handle associate issues at UNFI, that is a big point to be. I'm not arguing what people are coming in with. And I make it very simple by saying, impact over intent, focus on the impact. Like, you come to me with this issue, it's not my role to be like, well, are you sure he meant it that way? Maybe he meant it a different way. No one else has complained about it. It's like impact, focus on that. Don't worry so much. Just an example about someone using the word racism so much that you forget about the person experiencing racism. And that's something that unfortunately happens all the time. That's a very serious accusation. Are you sure about it? Versus checking first if the person is okay.
Another thing thing that I wanted to ask all of you about is burnout in the workforce. So I know that that's a big problem that a lot of employees are experiencing right now. You know, they're struggling because of the pandemic and a number of other things going on in the world. So how do employers create benefit policies that can really make a difference for employees who are burned out right now? Sabina, do you want to start us off on that one?
Yeah, so again, before you even jump into policies, I think it's really important for the companies to step back a little bit and understand that burnout is not about the person. It's not, because it's the entire labor for burnout is usually put on the person. The person is burned out. It's not about the person, it's about the company. The company is doing something that is making that person to be burned out, right? When you think about burnout at work, it's usually about unmanageable workload, is unclear role responsibilities. It's about not having a good communication with your manager, too much pressure put on employees. And I think, you know, one is really important for us. We have values that our CEO and our leadership and everybody's expect to live up. Our two most important values are care first, which is all about safety, and everybody belongs, which is all about just the diversity, equity, inclusion, respect. So really for us, we step back and always ask ourselves, like, how can we make the environment and the work safe? So if our people, for example, our Black people or brown people or people of BIPOC communities are experiencing so much harm outside of work, how can we at least make sure when they come to work for 8 hours, they're safe here, that they don't, we have absolutely zero tolerance for discrimination, harassment, right? A couple of weeks ago, what happened in England with the murder of Sarah, I don't remember her last name, but it really, you know, we had to come out again with a message to our employees saying we have zero tolerance against any kind of violence, harassment, because we want to make sure that our women are safe. And, you know, because lack of safety really quickly leads to a burnout. So creating spaces to talk about and normalizing burnout. For example, our CEO is very vocal about every day he has time blocked out on his calendar, and nobody is allowed to take any time when he has the blocked out time. And he encourages everybody to step away from your computer, go outside. It's a little bit different when it comes to our manufacturing employees, because they kind of work on a 24-hour, 12-hour shift, so it's different. But really, having the top leaders role model the behavior of like care first and everybody belong, making sure the flexible time is provided, making sure that we have floating holidays, like simple thing. Not everybody celebrates Easter that is coming up, not everybody celebrates Christmas, so really acknowledging that. And we do train, like I said, try to educate our managers around better communication, humility, and empathy.
Thank you. So across the board, employers should be having conversations about inclusive benefits and how to update their policies and do things that will really support underrepresented workers. But if they're not having these conversations yet, what's a good way to get it started? Like, how can we start having more of these conversations at work? Guillaume, do you want to start us off there?
Sure. Well, the first thing is normalizing that we don't always get it right the first time. So the idea of cultural humility. And this is a shift from what we're most of us, I hope, are familiar with, cultural competency. The thought that I'm going to send you to a conference, you're going to read all these books, and all of a sudden you're going to know everything there is to know about the best, wokest policy for that. No, cultural humility is looking at cultural competency as a moving target. What's appropriate and best practice today may not be so next year. So one of the things that we've done at UNFI is assemble a team, governance policy committee, constantly reviewing policies, doing the corporate equality index to really make sure that every year our policies for LGBTQ people is where it's supposed to be. Like, for instance, like redefining the definition of family. Is it inclusive of loved one? That's kind of like one of the things that people don't think about much. Like, if you're offering services for your trans associates, your transgender employees, when you're talking about cosmetic, like you're not covering cosmetic, procedures, what is considered cosmetic? Is it still, so really digging deep there. But finally, like just basic things like looking at the gender neutral language, which for some reason, many organizations still have he's and her, like throughout policies, including job applications. And really, like it's, at the end of the day, we need to not only create the safe spaces that we are all talking about, but really look at brave spaces. Like we don't have much control whether or not an employee feels safe at work, or after we have these conversations, what happens within their teams once we walk away. But one of the things that leaders in organizations can do, and like what we're doing at UNFI, is encouraging associates to raise their hand when something is wrong. Like encourage, like building those brave spaces. Like managers should be talking to their associate. That's one of the questions that I saw in the chat room there. How do you communicate those benefits? Managers should normalize talking to their associates about it. It's one thing to have flex policies, but are people comfortable raising their hands and saying, I actually really need to use this? Are we making sure that flexibility is not seen as a weakness, or even taking parental leave, being like, oh, I'm not as high performer as Karen, who had a baby and was back in the office right away? Like really normalizing those conversations.
Jorgen, how are you thinking about this for your workforce? Jorgen, did you hear me? I think you're muted.
Yeah, I think it's okay now. Yeah. Sorry, the sound was, I had a problem with the sound here, so I didn't get your question.
Oh, no worries. Did you hear me, or you want me to repeat?
No, I'm okay now. I can hear you. Yeah.
Great. But I was asking, how are you thinking about like having these conversations in your own workforce? Or how can other employers have these conversations?
Not sure. I really follow where you're going here.
Oh, it's okay. We can move on to another question then, unless anyone else has comments they'd like to add for this one.
No, I just wanted to go the points around the inclusivity in the language and taking a look at the policies on it. That's amazing. You're looking at it on you have a dedicated committee to looking at it on a annual basis. Just thinking about family building benefits for the LGBTQ community. I can't tell you how many times I've seen in a policy that the requirement to use assisted reproductive technologies to build a family are given amount of time with sexual intercourse without being able to conceive, which is the most alienating language for families. There was recent study around the family equality survey where it showed I think over 63% of LGBTQ millennials are considering expanding their families today. And assisted reproductive technologies, adoption, surrogacy as well are all becoming, more popular ways to build a family. So how can we structure our benefits to think about, to your point, all the different ways to define a family beyond man and a woman trying to conceive via sexual intercourse without success, for example. And I've seen that across. Again, I can't tell you how many policies that I've seen have that sort of that language in them, and needing to take a step back, rethinking everything, every policy from terms of language. Like, do they include and support your families?
Yeah, that's definitely.
I just want to quickly add just how super important it is too about the policies and finding inequities in policies. And for us, it's also very interesting because sometimes it really comes to us through our business resource groups. So we have very active business resource groups, and our women and our LGBT pride is very powerful. And they come and point out things to us. So bringing people to the table from totally different backgrounds, because sometimes, so many times I see, you get this, you bring the same people into the room to think about, okay, what gaps do we have in our benefits? What gaps do we have in our policies? And you're like, constantly the same people are just not gonna miss it. So really bringing all the voices that you're trying to focus on, that is really important.
And we always encourage people to go and speak to their HR and benefits managers. If you if you want to go and advocate for yourself, if you find that, and what we've seen too is often the HR and benefits manager are shocked by the disparities in their language and want to take action, and then didn't know that they were discriminating. So we always try to encourage people, if you notice something, just try to speak up. There's opportunity to make an impact if you have your voice heard.
Yeah, our employee resource groups, OpenText is early on our journey in a lot of this arena. And we just started having employee resource groups, which we like to call affinity groups, last year. And as we spin one up, it's one of the things that I tell them is that this is something we need from you. If you see something, come tell me. And a lot of times, people from underrepresented minorities, they do not feel like open door policy or not. No, I am not opening your door to tell you something so you can slap me back and then say I'm a troublemaker. Like, and this is like generational. This is an inherited view. So then the employee resource group creates that open space where they can say it to a minority that's more in a position of power in their view, that can then go take it. So then right now this is a new position at OpenText. It's a new department at OpenText, equity, diversity, and inclusion. And then I'm the leader of that. Then folks will say, well, I'm not talking to those guys, but I'll come to you. And I'm like, what do you got? I will take it forward. I promise you that. And then I come back and I report to these groups on how I'm moving forward their various ideas. And it's just such a great source of diversity of thought, just to ask your minority groups.
Yeah, definitely. And I think one of the things too is really, this is something that many organizations and corporations are scared of, but really acknowledging the system that we operate in. Like, the systemic racism is real and unconscious bias is real. And for us as an organization, we do lots of education around what we call inclusive leader. When we talk about systemic racism, when we talk about white privilege, when we talk about all these health inequities, when we talk about gender and racial bias, and we, again, just normalize it. So then we acknowledge that we already come out with this language saying, we know we have policies that are creating more inequities, and they have been created based on unconscious bias. So help us identify, like, we're open for you to come and help us identify, because we want to close those gaps. We want to create a more equitable workplace when everybody belongs, right? So really sending that language out from the leadership.
And affinity groups at UNFI, we call them BIGs over here, belonging and innovation groups, because, we want to do more than what many organizations unfortunately are doing out there, using those groups as essentially PR for social media. But those affinity groups and the Diversity Council have been crucial to really how the organization responds and when the organization responds to some things. Like today, for instance, with the trial happening, we know that many people are distracted, myself included. So we just had a conversation this morning. Should we say something now or after the verdict? Or do we say something now and also after the verdict? But if we do that, how do we do it? Who is it coming from? If both messages are coming from the CEO, but the CEO hasn't said anything specific to anti-Asian hate crimes yet, although we've talked a lot about it and we're having forums, but having two letters come from the CEO after we've talked about Breonna Taylor and George Floyd last year, it's really balancing all of that. But it's really been so rewarding to have this group of individuals, representative of like the US and Canada, weighing on those issues and really help our communication team draft those messages. Not everyone is going to be happy, but then again, as I said at the beginning of this conversation, it's not about making sure that the people with privilege are comfortable. And we've lost some business by taking a stance on issues like Black Lives Matter. Like people, and that's something that we're comfortable with, we stand by our values.
And I think it becomes even more complex when you think about global organizations, because like we were saying here before, and it was said before, minorities around the globe, really different issues, right, when it comes to it being marginalized. And that's what the business resource group and whatever groups you have in your organization, like, utilize them, because they are really going to educate you around what is going on around the world. For us, Brazil is big because there's a lot of health inequities going on in Brazil. There's a lot, Black Lives Matter in Brazil, things that you never thought from the US perspective that are happening. But because we have our Alliance with Black Employees group in Brazil, we as an organization talk about it, what is happening in Brazil, and it really connects people because we see that, everybody struggles. And we are struggling. And as a company with values and purpose, we want to make better. We want to make life better for everybody, right? We want to really be mindful of what we're doing in the communities and what, are we causing more harm or are we helping the communities we operate in?
Great, thanks so much, everyone. So we're at the top of the hour now, so I'm going to toss it back to Steve real quick before we start our Q&A. And just a reminder, drop your questions in the chat and we'll try to get to as many as possible. Steve?
Thanks, Caroline. Thank you all to all of you who are participating in our webinar on how to embed diversity and equity into your benefits for all families, and to our sponsor, Ovia Health. I've seen a few chat messages asking when this amazing discussion will be available as an on-demand video. The answer is very soon. The link will be in the email you'll get tomorrow, which will also have your SHRM and HRCI credit info. With that out of the way, at this time, we'll be taking some questions from the audience, and that's you. Over to Caroline.
Great, thanks, Steve. All right, so the first question that I'm seeing here, is there typically a gap in coverage or more a lack of use of the benefits currently being offered by employers? EAPs are historically underutilized, even where the coverage is excellent. Anyone can feel free to jump in if they have thoughts.
I'll take a shot at that. A lot of that depends. In my particular situation, we have an internal EAP, and one of the differences is that you have the ability to kind of address some issues internally because you work within a group, you kind of know your employees, and you have the ability to tailor your benefits based on and your services based on the needs of employees. I've been in other environments where you didn't have EAP, and it was pretty much a third-party administrator. As a lot of people have said on this call, EAP and behavioral health is now a critical factor in wellness. Wellness we used to talk about wellness, about health is health. No, I think it's three factors now. It's total wellness, and wellness means physical, emotional, and financial. So that emotional behavioral health piece is such a significant piece that we all got to find ways to try to address it and have the ability to get reaching people and getting them to feel comfortable. I think that's probably one of the biggest gaps in terms of this whole pendulum, in terms of wellness, that we need to impact. But like I said, I have the advantage of having an internal EAP. I see the difference. And you set up programs that are specifically target more so toward wellness, mindfulness, yoga. You're doing things that kind of take away the taboo of the traditional mental health, or someone saying, well, somebody's going to EAP because they got A, B, C, D. More so, I'm going for my wellness in order to make me a better person. So from that perspective, I just wanted to share that because I don't know if any other the panelists has an internal EAP, but that's been extremely beneficial for us.
Yes, I was just going to add that some of the inequities we see with EAP, racial and ethnic minorities are taking less advantage of those, unfortunately. And it doesn't just stop at EAP. I also view the participation in things like 401k, tuition reimbursement. I mean, health savings account. I have a background in healthcare and I still call my friend. I've worked in an insurance company, but I still call my friend who does that for a living to have her help me decide which plan is best for me and my family. So people who never really had to think about 401k and health savings account, as they're starting a new role, what is the likelihood that they're taking the time to educate themselves and reducing their paycheck to think about the future? when we know that most of America does not have $1,000 in the savings account. So it's incredible. I mean, it's unfortunate how the lack of creativity that I see in organizations over and over again when it comes to encouraging people to take advantage of these offerings.
Joran, does your company offer EAPs or perhaps an international version of those types of programs?
Yeah, yes, we do, but not in as one global platform. I mean, basically, we are very focused on understanding the local country, the local customer, and as such, we have more been going towards solutions which works in the country, or sometimes a range of countries, region, etc. So that has been our approach to it, and I completely agree to what Louis was saying before around EAP, that the more you understand your customers and the more you're ready to go in and adapt it to those, very clearly that's going to help in the take-up of those, because you often hear extremely low percentages, and of course you can say, well, very often something you don't use unless you're in a situation, but still, depending on what you're offering in there, that they could change that.
Thank you. I actually have another question about EAPs as well, which is very related to this from an attendee. So regarding EAPs, many employees are reluctant to use them out of embarrassment or concern about privacy. What can we encourage employees to do to ask for help?
Well, I'll try again. I guess since I'm a little bit more involved with EAP, I think we have to encourage kind of what I would call almost consumerism, or making the employees more involved in the healthcare decision-making process. And in terms of, we have to make it more inviting for employees to take more of an active role in what's going on with them. I mean, if I'm having some issues, whether home with my child or whatever else, or whether it's financial or whatever, then I have to have, one, the comfort to know that I need help and it's okay to get help. And we have to, it's like a lot of us have said, especially in the minority community, you know, growing up, it was always kind of taboo. So you know, and we've worked to try to erase that, but there's still ways to go. One is confidentiality. If I go and talk to someone, you know, who's going to find out how, you know, what's the negative impact, you know, of somebody finding out, well, I went to saw a clinical social worker. Well, you know, the question is, well, what's wrong? I mean, why are they going? Well, what's the issue? And all of the things that are associated with that. I mean, we have to learn to make it more inviting and for the consumer to have a more of a role in the healthcare decision-making process and what's going on in their lives.
Yeah, and I totally agree. And it really goes back to normalizing again. I know how many times we're going to repeat this word today, but it is about having those conversations about mental health and a bigger stage. So for us, what we try to do at Ingredion, we have inclusion circles will happen once a month or even more than once a month, because it's something that, you know, we respond to whatever is happening in society. So a month ago, we were doing a lot of, we had a talk about mental health in Black community. And when we were providing these like kind of off therapy sessions, you know, the Black workers were talking to each other saying, you know what, this was so great. And we're encouraging each other to participate. So it's, you know, we talk about different things that are happening. We talk about mental health, burnout, and we try to normalize it because it's still so much stigma going on around mental health. Like Lois was talking about, it's embarrassing. It is embarrassing who's going to find out that I'm looking for, a therapist, or who is going to find out that I need financial help. So things like that, but just really opening up. And I think we are still kind of in a way operating in this myth that you have your personal life outside of work and you have your work life and you have work at work. And I think these boundaries are gone with COVID. And I think people are just really, becoming more closer to the coworkers and seeing that everybody is struggling. So again, normalizing this, conversation around those very difficult issues, not making it taboo. Like in your workplace, it's okay to talk about it. It's okay to seek seek help. Nobody is okay.
Oh, absolutely. And at Ovia, we've noticed with our employers that we work with thousands, and a lot of them will invite Ovia's clinicians into their affinity groups. So we'll have a mental health social worker or a registered nurse go in virtually today to moderate discussions around mental health to the parents group or the women's group. And that's done a lot of help to normalize the conversation that it's a safe place to discuss mental health. A lot of our clients also try to think beyond the EAP. What they value in Ovia is that it doesn't necessarily overestimate a person's ability to self-advocate. So we're all thinking there's these people that think they have a problem and they're raising their hand and they're going to call a telehealth program. But in reality, like what we've seen with our audience is that these perinatal mood disorders and mental health amongst parents is wildly undiagnosed. People don't, is this the baby blues? Is it something more? We actually presented at the American Psychiatric Association showing that perinatal mood disorders, we are identifying at 3 times the rate as a clinical setting, with suicidal ideation actually spiking in the fertility phase as opposed to postpartum when it's traditionally screened. So just beyond the EAP, what are other ways to proactively outreach people with more of a daily program or something that feels a little more anonymous or secure, like a digital health program like Ovia, where they feel like they're in a safe place, and then they're not just calling a provider on their own, that solution is proactively reaching out to them. Do you want to talk about your mental health or how are you feeling today? It's one of our most popular questions in Ovia that we send is just, how are you feeling today? And it really gets those conversations going of somebody that might not have ever raised their hand or called a mental health care provider or an EAP if not for that.
I think what Gina said about security is so important. I mean, trust is unfortunately something that many employees don't have with the employer. I mean, especially in my generation, unlike my parents' generation, is way more likely to just up and leave once we no longer feel valued at work versus the let me make myself indispensable, which is things my parents were telling me. And I still try to do, but I've come to the conclusion that once I'm no longer valued, it's time to move on. But one of the biggest barriers to utilizations of EAP and frankly speaking, access to mental health is toxic positivity. The whole movement of positive vibes only, especially during this pandemic, it's okay if you did not learn how to make really good bread. I did, but it's okay if you didn't. And it's okay not to be okay. And being frank and really open about these things, I consider myself a pretty open person. But honestly, last year was the first time in my career when I opened up about my personal mental health issues with some people. I mean, I've always had some anxiety and depression, but it wasn't until last year that I was like, you know what, it's okay for me to mention it. We don't need to go into details, but that's something that I'm dealing with. I take medication and it really helps. And here are some of the services that you can have access over here. And back to the trust piece, making sure associates know that this is a third party, not related to the organization, and repeating it over and over until they believe it.
That's a good point. We found in a lot of different areas as we do our D&I work at OpenText that you just have to explicitly sometimes say from on high about how people are protected, about what things are confidential, about retaliation policies, about how you're protected, where the data is stored, all of those types of things so that people can be reassured. Because to assume that there's trust, to assume that of course the employee knows that the EAP company isn't going to say, oh, guess what, such and so is bonkers, they cannot assume that. And the reality is, when you look at let's just say the history of unionization, employees are not crazy to need their trust to be earned a little bit. And it's okay to spend some time reassuring them. And I'm always like, do it in writing, do it verbally, make it from on high, do it repeatedly. That's how you earn the trust. And then be transparent about other types of things. Like you say you're going to do something, then do it, report back. Don't just do it and don't let people know. You know what I mean? So that's huge. And I've found in our affinity groups, I try to bring in these discussions around mental health. And then they hear it from someone that's more of a leader. Back to Sabina's phrase, and you're so right, there's a lot of things we need to normalize. That's about shifting the culture. That's really what that means, is shifting the culture towards humility, empathy, acceptance of reality, and that toxic positivity. Yeah, you're right. There's nothing wrong with trying to feel better, but to do it to the point of denying reality, that's not good for anyone, right? So yeah, I definitely support that. And good job for you sharing about the things that you deal with, Guillaume, because that makes such a monstrous difference for people to feel like, oh, okay, well, here's a successful person doing well in their lives, being their best selves, and the world, and they talked about this, and the world didn't explode. Turns out it's okay, you know, and that helps re-normalize. It gives people examples of how this is normal and okay. You know what I mean? So good job.
Yeah, thank you for sharing, everyone. The next question we have is also about mental health, actually. What programs do you recommend for mental health as well as, and also childcare?
I responded to the chat earlier that one of the things I'm working on at UNFI is a partnership with either Better Health or Talkspace to just, you know, if associates still do not trust the company, they at least have an ability to use their phone to get in touch with a therapist outside of us, you know, and that's a partnership that many other organizations are considering. So, and we're also, during the pandemic and post-pandemic, we will be covering some childcare services for some of our associates.
So this next one is, New Zealand recently passed a legislation for paid 3 days of bereavement leave following a miscarriage. This applies to both parents and also includes adoption and surrogacy. How might US companies adopt this type of policy?
I mean, at OpenText, what I've experienced in writing and changing policies is when we find something great that another company or country has come up with, or some great idea, go do it. Like, just write it, figure it out, you know, find your stakeholders and move it along like it matters. That's policy change, right? Identify where's the policy, identify your stakeholders, and then do the dance of getting to know those stakeholders, writing the new policy, and getting it blessed. And it's just a process, and embrace the process. That's just how it goes. You identify it, and then you go and advocate for it.
We have the bereavement policy for pregnancy loss. And I think I put it in the policy, just went to our HR and mentioned, you know, 30% of people, up to 30% of people experience loss. I've experienced loss, and this should be part of our bereavement package. And it was next week, it was updated. It's just a simple policy change to include that one area. And then it was about communicating it in a respectful way. But I had several team members afterwards that experienced a loss and were able to use it. And it's, I'm glad we're able to offer some level of support for people that are all experiencing that very differently.
I think it's also one of those places where, okay, thanks, Guillaume.
No.
Yeah, I think it's one of those places also where you can really show as a company that you are socially engaged, because you can take some of those things. The New Zealand one was an excellent example, but we are putting basically what we call our care program, where we're taking a number of situations which can either be, you know, unfortunate situation where you need to go to hospital, or your family or a family member dies, or the happy moments in life when your child comes into a family and so on. Then really show your responsibility as a company and put in a global program with a certain minimum level of coverage, which then makes sure that all of your employees and their families basically are covered in this, and which as the whole ESG, you're all talking a lot about the environment. There is the S is coming stronger and stronger. And a lot of people are saying that in connection with the COVID, that's going to be the next big thing. That's really a way for us to show as corporations that we can show social responsibility and commitment and drive this in the world to basically help also in countries where there are not such good systems which support our people, that we then as corporations jointly take over and show the way, so to say.
I just wanted to quickly emphasize that there's only so much employers can do for their associates. There's compensation and flexibility in terms of benefits. So it's so important for us to look at these benefits as a recruitment tool. If you're trying to hire diverse talent, these are the policies that attract that talent. Like for instance, in my former role at the Blue Cross Blue Shield, we rolled out a paternity policy, PAW for your pets. Of course, it's not going to be a huge expense, but those are things that are catchy enough and interesting enough to just even boost the morale among associates. I'm not a pet person, but many of my colleagues were incredibly excited about it. So just really looking at the benefits or implementing some of these inclusive policies.
This next one is about benefits communication specifically. Any creative ways to communicate benefits to a workforce that does not have easy access to computers?
Everybody's got a phone, almost.
Right.
Good point, Jorgen.
At UNFI, a good portion of our associates in operations are working, distribution center warehouses, where they actually are not allowed to use their phone for safety reasons while they're on the floor. So one of the things that I'm starting with the Diversity Council is have Diversity Council on the road. We're across the country, but we are dividing and conquering, sending associates on the ground in these distribution centers to have conversations with associates working there. We have televisions in the break rooms, and making sure that if you're going to have televisions in the break room, all the videos are posted with closed captions so that as they're eating, if the sound is off, people can still see those messages. And also the policies, what languages are they in? Are they accessible? We have essentially Cliff Note versions of all of the policies in very accessible languages.
Yeah, definitely. For us, it's something we're exploring because our associates don't have access to emails, and we are looking into platforms such as like different apps. But I think for us, for right now, what we're doing is really using our business resource groups, because we have a pretty, developed DI, what we call DI infrastructure. So many of our plants around the world have already business resource groups. So we communicate a lot through our business resource group, and through the councils too. We have the for regional councils. So we try to, really, really utilize our employees and send a message to the associates.
So this next one is, can you recommend good resources that will identify health inequities being experienced by different groups?
Can you read that one more time? Is it like I'm just thinking right away when you read that, there's so much like research about inequities that are happening in different communities. So is it right, like research and reports that have been done around inequities?
Yeah, I think that's a good resource. Is there anything that you'd recommend to read?
Or I think if you even just Google health inequities, there's so many reports that have been done recently around the pandemic. Women in a workplace report for women, and then women of color through McKinsey as well. Deloitte has a lot of on human capital. These are a couple that good to start with.
Yeah, I would just say that organizations should not hesitate to hire a third party to do a lot of these assessments. things like even pay equity. And earlier I mentioned at the breaking down the utilization of EAP or health services. You know, if you're looking at all of that, if you're looking at your numbers and you see that hourly workers are not accessing some of these services as much as a salaried worker, I mean, that's an income inequity rate that, you know, you should explore. So really starting there and asking yourself, why is it that this group of individuals or women are not using these services as much as men? And most organizations do not have the capacity to do that, which is why it's so important to hire a third party and get that fresh perspective on your data.
This next one is also about mental health. So I've noticed in recent years that employers expect their employees to do more with less. How are companies managing this expectation, but providing the mental health support that their workforce needs?
Coming from healthcare, doing more with less is something that we've been struggling with for a long time, expecting doctors, for instance, to spend less time with patients, but address social determinants of health. I need to ask this patient about, are they eating well enough, their housing situation, and code all of this at the same time. So one of the things that's been important in that role and in my current role is talk about burnout, which is something that we addressed earlier on. Like, these people taking care of other people, are they being taken care of? You know, are they taking care of themselves? So that's kind of been key there for us.
I would also say one side of this is, are people being given the right flexibility and technology to do more with less? And I've also been in healthcare, and it's like it's the ongoing thing. And I mean, we watch it in other industries where they're slowly like less and less and less, like teachers. And maybe sometimes we need to ask ourselves, when are we going to stop? Like this concept of let's just get more efficient, do more with less, do more with less, do more with less. I think when we talk about like addressing our culture and examining where we're coming from, when people talk about a humble culture, an empathetic culture, some of that we need to address. Why is it a never-ending expectation of that? There's nothing wrong with getting more efficient and doing more with less. And at OpenText, we are extremely proud of how very, very efficient we are. But you also have to acknowledge that there are simply limits when we come to the burnout, and to look culturally at what is this concept of wringing the life out of folks for the good of whatever the mission is. And to say, is that actually good for the mission long term? Really? And to really address that. And I was really impressed with, like, if you look at the history of France and their work laws, it came around to people saying, whoa. You promised me with computing and technology, I would be more efficient, be able to do more in less time. And now somehow still I'm supposed to be working 50, 60 hours a week. That is not fair. Where is my win? And legally the win was, wow, you're right. You shouldn't have to work as much because you are more efficient. And now there's like a shorter work week. It's like a 30-hour work week with like these giant benefits. And here we are many years later of changing things. And guess what? France is doing fine, it turns out. Turns out they're doing great. You're okay. You can keep your economy going. So there's the side of enable people, right? Give them flexibility, give them tools, give them what they need to be highly efficient and to do more with less. But then there's the other side of check your culture a little bit. Think about that. What is really the end game here? Like, there's this whole biggering and bigger. You'll see the Lorax on the bigger and bigger and bigger and bigger and bigger, and then what? We're all just collapsed. You know, we kind of look at that when you look at some of your global climate challenges, right? Some of the challenges we have are about, let's take a step back on that and do the other side of being mindful about what's motivating us in our culture. We actually are sentient beings. We get to choose our culture. We don't have to just inherit what came along, what made sense for past generations and just run with it and run ourselves into the ground. We have an opportunity when we're saying we can do more with less, we have technology to also redefine our work culture and redefine those goals and say, wow, we can be wildly profitable and not burn people out, actually. You know what I mean? And look at it from that angle too.
Great. Well, it looks like we're right at about time. So I just wanted to say, thank you to all of you for being here today, for being very open and honest, and for sharing your experiences. I really, really appreciate it. And I think it was a really great discussion. So I'm going to throw it back to Steve real quick, who's going to wrap us up. But yeah, thank you all again.
More thanks from me. Thank you, Caroline, and our wonderful speakers. We were fortunate to have such richness of expertise and opinion among all of you today. It made for a great conversation on a vitally important issue. Thanks again to our sponsor, Ovia Health, and to all of you for participating today. If you'd like to join us for more virtual events, you can head to our website, fromday1.co, and check out more of our upcoming webinars. This Thursday, for example, April 1st, Leading with Gratitude for Extraordinary Business Results in 2021. Next Tuesday, April 6th, Serendipity, the happy accidents that bring teams together. And finally, next Thursday, April 8th, Employee Stress, how to identify the signs and find new remedies. Thanks, everyone. Stay well. Bye from Day One.